Hello, my name is Roland Valori. I'm a hospital doctor and I'm HQIP's Clinical Lead for accreditation. In this video, I'm going to tell you a little bit about accreditation, the benefits of accreditation, and give you an idea of the sorts of steps a clinical service has to go through to start an accreditation scheme. And within that, I'll be talking a little bit about HQIP's role and the resources HQIP has to support clinical services. Clinical Service Accreditation is validation of the quality of a clinical service. Essentially, it involves a peer review team inspecting a service against a set of standards. For example, the endoscopy accreditation scheme is a long-established scheme for 10 years, and a nurse, a doctor, and usually a manager will inspect a service over a period of a day against a set of requirements. Now, we appreciate that this can be burdensome, and to harmonise the process and reduce the burden, we have created a set of requirements through the British Standards Institution, which is called a publicly available specification, shortened to PAS 1616. And this lays out exactly what should be in place in a high quality clinical service. The benefits of accrediting a clinical service are significant. The first thing to say is that the pathway up until the point of accreditation enables a service to bring some structure to what they're doing and thereby improve their processes. But ultimately, what it does is it improves the care of patients, makes care safer, and it provides reassurance to those accessing the service that the service has achieved a given standard of quality. We expect in the future that the quality mark of accreditation will be used by regulators and commissioners to help them regulate and commission services effectively. The Clinical Service Accreditation Alliance, shortened to CSAA, has been working for 2 to 3 years to develop an overarching strategy for accreditation to harmonise the way we do things and to introduce some consistency to the approach with the intention of improving the processes and reducing the burden. Now, the preliminary strategic groundwork has been completed, and the sponsors of the Alliance work have asked HQIP to take things forward in the next stage. And basically, this means implementation of the strategy, working with clinical services to prepare them for accreditation. The steps required to develop a clinical service accreditation scheme are, first of all, for the clinical service involved to fully understand what this means and what the consequences would be and what resources are required. Following this, there are a number of other steps, and in these other steps, HQIP has a number of resources to support clinical services go through the process. Some of these steps involve creation of a leadership and governance team, and it's very important that that team contains all the stakeholders of the service, including patients and third sector. Secondly, and very importantly, the generic set of requirements, the PAS 1616, needs to be underpinned with service-specific requirements such as guidelines, indicators, metrics, NICE quality standards, etc. The support that's available from the HQIP team is principally for the early part of the journey in preparing for a clinical service accreditation scheme. Now, HQIP has a team with expertise, knowledge, and resources to support a clinical service in these early stages. So the sponsor group continues to have overarching governance and responsibility, and will continue to work in partnership with HQIP to continually refine what is done. In the immediate future, HQIP is having conversations with several services with the idea of nurturing 2 or 3 early adopters to the point of commissioning an accreditation provider in the first year. Thereafter, we would expect to take more clinical services through this process. Now, if you are interested in accreditation, if you'd like to hear more, if you'd like to be involved in some way, or very particularly if you would like your clinical service to start on this journey, then please contact accreditation@hqip.org.uk.